Healthy lungs contain millions of tiny air sacs called alveoli, where oxygen enters the bloodstream and carbon dioxide leaves the body. Pneumonia begins when bacteria, viruses, or fungi invade the tiny air sacs deep inside the lungs. The immune system responds immediately, sending white blood cells to destroy the invading microbes. This causes inflammation. As inflammation increases, the air sacs fill with fluid and pus, making oxygen exchange increasingly difficult. Because the lungs cannot transfer enough oxygen into the blood, breathing becomes rapid and oxygen levels begin to fall. Patients commonly develop fever, productive cough, chest pain, fatigue, and difficulty breathing.
Chest X-ray or CT scan, blood tests, sputum analysis, oxygen saturation, and microbiological cultures to identify the infection and guide treatment. CT scans clearly reveal inflamed lung tissue and fluid-filled areas, known as pulmonary consolidations.
Respiratory support, antibiotics, antifungals, and antivirals eliminate the respective infection, allowing the inflamed lungs to heal. Poor or untreated pneumonia complicates to pleural effusion, empyema, lung abscess, bronchiectasis, and permanent pulmonary fibrosis. Vaccination, good hygiene, avoiding smoking, and early treatment protects lungs and prevents complications.
Welcome to this medical masterclass on pneumonia. We will explore the clinical framework for understanding, diagnosing, and managing this serious infection of the lung parenchyma. Pneumonia is defined as an acute infection of the lung parenchyma, characterized by inflammation in the alveoli and the buildup of purulent exudate. This process impairs gas exchange, directly reducing systemic oxygen delivery. Understanding the etiology is crucial. Pneumonia can be caused by various bacteria, viruses, or fungi, and occurs in different contexts, such as community-acquired, hospital-acquired, or ventilator-associated cases. Identifying the specific pathogen guides both diagnostic testing and treatment. Several risk factors contribute to patient vulnerability. These include demographic factors, lifestyle habits, underlying comorbidities, immune status, and iatrogenic or neurologic conditions that may predispose individuals to infection. The pathogenesis of pneumonia follows a cascade, beginning with pathogen invasion and leading to macrophage activation, inflammation, and infiltration. This culminates in consolidation, alveolar collapse, and a VQ mismatch that hinders effective gas exchange. Lobar pneumonia progresses through 4 pathological stages: congestion, red hepatization, gray hepatization, and finally resolution, as the lung tissue recovers from the inflammatory process. Clinical presentation involves a mix of systemic indicators and respiratory symptoms. Physical examination and vital sign monitoring, such as tracking SpO2 levels, are vital for recognizing severe cases of hypoxemia. Radiological assessment is multimodal. Chest X-rays, lung ultrasound, and high-resolution CT scans provide distinct signatures, from lobar infiltrates and air bronchograms to B-lines, consolidation, and cavitary lesions. Laboratory diagnostics are essential for confirming the diagnosis and identifying the cause. This includes blood work, microbiological cultures, antigen testing, and gas exchange analysis via arterial blood gases. Severity assessment determines the appropriate care setting. Tools like the CURB-65 score and the Pneumonia Severity Index help clinicians decide between outpatient, general ward, or ICU admission. Treatment protocols are phased. Initial care focuses on supportive measures and broad-spectrum empiric antibiotics, which are later refined to targeted therapy based on specific culture and sensitivity results. Timely intervention is critical for a positive prognosis. Delayed treatment increases the risk of complications such as pleural effusion, lung abscess, ARDS, and eventually sepsis or multi-organ failure. Prevention is our best defense. This includes vaccination, maintaining hand hygiene, smoking cessation, and good nutrition to support overall immune health and reduce the risk of respiratory infections. The clinical action algorithm provides a clear path. Suspect based on symptoms, confirm with diagnostics, stratify by severity, and then implement the appropriate treatment and monitoring strategy. In summary, managing pneumonia requires a comprehensive approach covering clinical presentation, accurate diagnosis, risk-stratified treatment, and ongoing prevention efforts. Thank you for watching.